Thank you for staying back. I promised that I would be sharing some of the insights that we have been doing from last around 18, 20 years into this industry. And, so I come from DreamSol, and there are certain case studies that I want to present to all of you. So I'll be very quick because I know, all of us are already delayed. So one quick question to all of you. What's the common thing in all of this? What's common among these big shots of healthcare and wellness domain? Any guesses, please? So we have Medanta, entire Apollo, entire Max, Reliance, entire Esther, Breach Candy, Jaslo, Hinduja, Amri, all of these, SCG, entire SCG. So, the common part into all of this is very simple. They use our enterprise productivity management applications. And we have been blessed to learn from all these healthcare leaders. Many of them are present today, and it's a privilege for me to present some of the case studies with respect to it. So we are currently catering to around 50 million patients every month. We are touching them through all of these hospitals, basically. So I'll tell you how we are trying to change life for these patients. We are trusted by around 200 plus hospitals, many clinics, many pharmacies. We are present currently in around 8 to 9 countries, and this year, this next financial year, we are going to move to 5 more countries actually. Now, when we started with this company, we thought there is HIS, which was 15 years, 16 years ago, and we wanted to do something beyond that. So whenever you are thinking beyond HIS, we say there are productivity management applications. A lot of people ask question to me, what do you do? What does DreamSol do? So we are into productivity management applications, which are focused into patient experience, patient engagement, and operational excellence. And we have created a framework over these 3 focus areas. The best part is, whatever our clients advise, actually, we customize for them, even if we have standard applications available to us. But whenever any client come to us and they say we need certain customization, we try to build up in such a platform manner that it can be very well integrated and configured with their workflows, basically. So that is the kind of crack that we could do working with the market leaders of the healthcare. This is the journey that we have discovered when we are talking about patient experience, and a lot of panelists were talking just before this session. So as per our understandings, what we have done is we have actually identified various touch points for IPD, OPD. When I say OPD, it's all health checkup and all other things apart from IPD actually. So what we have done is we have identified all these milestones, and through our different solutions, we have tried to tie the knot between all these touch points. Now, let me just give you an example. Suppose, and this works well when the patient is a repeat patient, because we have that data of the previous patient in terms of demographic, in terms of their preferences, which we capture through different mobile app. We have the patient category. If the patient is the CEO of certain organization or handle with care patient or whatever. So with that data, we create the magic. How we do that? So whenever the patient is getting an admission, there is a proactive alert which we throw out to certain action group who are prepared to know that this particular CEO is fond of South Indian food, or this person has last time complained about, AC too chilling actually. So how we can cater is whether it is related to any kind of last preferences or any kind of issues that they had faced. Here what we do is we try to build certain analytics over it and we throw alert on it. When the patient gets admitted, what happens is we throw certain WhatsApp or SMS alert. There is a hyperlink, and this hyperlink is a kind of key for them, and that remains active until their discharge. So they can avail any kind of request, any kind of complaint through that URL, and it's very user friendly. I have certain screens, I'll show you that. Now, so this is how we do. During the stay, we have certain QR code next to the bed. As soon as they scan it, the patient demographic details are already known because it is very highly integrated on real-time basis. So we have a lot of such things. Similarly for OPD. Now the best part of it is we have something called severity assessment metrics, which is around 800 plus kind of requests, complaints that we have segregated over severity 1, 2, 3, and 4. And these severities work with different TAT, and that is how the service is delivered. So this is one of our integrated patient experience journey that we wanted to show you. The second is with respect to CRM. Now, the biggest challenge that we have seen with healthcare industry is all the big CRMs of the globe, they want healthcare to change their workflow the way their CRM is. For the first time, DreamSol came with a CRM which is built for the healthcare, by the healthcare leaders. And we recently have kind of implemented with the largest of the groups of Asia, basically. And we could go live in just 2 months with the complete, configuration and innovation. It is highly integrated. So whether it is sales productivity tracker or lead magnet or wellness CRM, where the patient gets repeat patients, we can tell them that what should be the next milestone and all. We have a lot of operational excellence application. The good part is we have collaborated with Asia's largest hospital for this, and we created around 25 plus operational excellence application around it. There is a hack that we created basis that. So what we did was, we have always identified the process. Now, one of the biggest pain area that all of you will agree with is the patient discharge tracker. Basically, whenever the patient gets discharged, there is a lot of delay. That is one of the complaints. So we could actually help out a lot of hospitals with respect to it. We could identify the process, we could identify the owners, and then there was an exception report that what is going wrong. And we could, figure out how it should be done. Now, these are certain tools that we have created over this. And, all of these are being used by large hospitals. So the processes are already kind of very well proven and very much configured with respect to it. Now, I'll quickly jump on the success stories or the kind of case studies that I wanted to actually present. There are 8 case studies that I want to share with all of you, which have actually transformed the way today these hospitals are operating. One of this is, of course, one of our hot selling cake. I wanted to start off with that, which is patient delight management. It is being trusted by, more than 150 hospitals and so what we have seen is many of these hospitals are focusing only on NPS, which is Net Promoter Score. However, I'll just quote you, and because I can't take names of our client with respect to all of this, but then I'll just, kind of make you understand. One of our hospital, they identified that from the pediatric department, the NPS is always low. And then they figured out, so our application have held them out to figure out the root cause for it. The root cause was, the children were, kind of creating mess around it because of the waiting time. So now what we have, what this hospital has done, basis the information which our application has given, is that they have hired one magician who is engaging these kids, and the NPS actually had gone up. So these kind of, practices, and these are very small practices. Our application can only give data, and it can indicate that what best can be done with respect to it actually. So there is a lot of predictive analysis. There are a lot of insightful dashboards that we give. The next one is more about related to, the complaints, because whenever the patient get admitted, the best thing that we focus on is on the ambience, because today hospitals are more like in 5-star kind of hotels. All of us know that, but there are small things which are missing. So one of the largest hospital of Asia was using US-based ticketing system before they migrated to us, because that particular application was not designed for healthcare. So we created this, and they are addressing more than 50,000 such requests and complaints in a month, and they have extended to all their other units. And now this is being used by a lot of other hospitals. So this was one of our first application that we have given to the industry actually. This is amazing actually, How can you say that, transforming customer queries into revenue? So here what we have done is, the largest of the chain at Middle East, they our chain of around, say, 100 clinics and 250 pharmacies. They have 100-seater call center. They get lot of queries, customer complaints, and lead also. We could monetize them with respect to dynamic workflow that we created with respect to them. And then this could actually help them out to generate lot of revenue with respect to this. We have certain application with respect to patient safety, where audit checklists are created basis NABH, JCI, DHA, whatever kind of guidelines that you want to incorporate into. When I was showing this to one of the large hospital of Mumbai, they said even if it can help out our fire officers who can actually take the fire extinguisher audits every month, that can help them out. So now fire extinguisher officer can go and take a picture if something goes wrong from the mobile app. They fill up this and they can kind of take this forward. So likewise, this can be used for nursing and patient safety. A lot of other departments are already using it. This is, in healthcare, what we have seen is the back-end portion is the asset. And for asset, the hospitals are not really ready to invest, for patient deliveries and all. So what we created was, we created a complete workflow of complete asset management, where, each and every stage was very well configured in such a manner that the asset actions can be taken. There are a lot of auto reminders. It's a very large application, very generic in nature, can be utilized, but this is giving very efficiency for all the asset. It can generate certain alerts. It can, give lot of reminders like contract renewal and lot of other things. Operation excellence, I have already talked about it. It is one of the hot selling thing right now for hospitals who want to work on the John Hopkins model, or organizations like Gallup and all, who are actually kind of consulting these organizations to do on operation excellence part. Now, this is one which I was telling you, where this complete sales force of the healthcare can actually be brought into this app. It's very user-friendly, just 4 or 5 pages app. And all of the salesperson, what they have to do every morning, what are their tasks for the monthly schedule, everything can be seen over it. People are actually migrating on this from the large legacy systems. And this is kind of helping them in a very effective manner, even if they are not very technology friendly, but still they can very easily use it and they can get the complete revenue. Everything is very well integrated. It's a 360-degree kind of app which we have created. Now, these are certain screens. Now, you see, this is the sales app I was talking about. Very simple. As soon as the salesperson actually opens up in the morning, they see that these are the activities every day that they have to go, tour plan, what is kind of other engagement activities that they have to do. Every task can be seen like this. It is very user-friendly in terms of any screen devices and all. The bedside QR code can be seen, where it is multilingual in nature, and it can be seen and can be taken care of. Dashboards are very analytical. All of this can be taken in such a manner that it gives a lot of insights. Every application comes with more than 50 plus loaded dashboards, and we are improving. We always say to our clients that we will not charge anything for your dashboard or MIS. We are going to give you complimentary, because we also want you to get benefit out of the data that is being generated through different sources. So we are around 19-year young company who are based out of India, UAE, and UK. And we work on to open source technology. We want to create certain disruptive productivity tools, and hence we are working with the market leaders. This is all about us. So let's get started. Thank you so much.